If you want to use your Blue Cross Blue Shield Federal Employee Program insurance coverage for your hearing aids, then this video is for you. Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and in this video, I'm explaining how you can get $2,500 towards whatever hearing aids you want using the Blue Cross Blue Shield Federal Employee Program. I think we can all agree that insurance coverage is lacking when it comes to hearing aids. Honestly, you could pretty much make that argument for every other area of medical care in the United States. However, there are some insurance programs that do a pretty decent job of giving hearing aid benefits to their members. One of those programs is the Blue Cross Blue Shield Federal Employee Program. Of course, if you do have what we call FEP, there are some things that you need to know if you actually want to use this benefit to cover part of the cost of your hearing aid treatment. So of course, I'm going to be covering those basics in this video. But before I do me a huge favor and click that like button, and if you haven't yet subscribed to the channel with notifications turned on, go ahead and do that as well. And while you're at it, let me know down in the comment section what type of insurance you have and if it covers hearing aids. All right, let's first start out by talking about the three different plans that the Federal Employee Program has. You have the FEP Blue Focus, the FEP Blue Basic, and the FEP Blue Standard, all of which have at least some hearing aid coverage. The FEP Blue Focus is the lesser of the three. It does not provide any coverage towards hearing aids, however, it does give you access to the Blue 365 discount program. The Blue 365 discount program is administered by several different third-party administrators, including True Hearing, Great Hearing Benefits, and Start Hearing. They also offer some access to the Jabra online hearing aids. In order to use this discount program, you have to go to a hearing care professional who is in network with one of these third-party administrators. There is absolutely no out-of-network hearing aid coverage when you're in this plan. Just a quick caveat here, you have to be very careful when you go to one of these discount program providers because they are typically not providing you with very high quality of care, which means that you will probably not hear your best when you get treated with hearing aids inside of their clinic, and they do not have access to all of the best hearing aid technologies out there. Of course, unless you're willing to pay privately with a hearing care professional who follows best practices, you're going to be stuck with one of these discount programs. However, if you have either the FEP Basic or the FEP Standard plan, you have much better access to a high quality provider and better technology. FEP members who have one of these plans will receive an allowance of up to $2,500 every 5 years that they can apply to hearing aids or hearing aid supplies. This means that you can go to an in-network provider with Blue Cross Blue Shield or an out-of-network provider with Blue Cross Blue Shield and still get access to the same benefit. So basically, if you're smart, you're going to find the best hearing care professional to make sure that you get the most out of your hearing treatment, and they will be able to access these benefits. There is also no restrictions when it comes to getting the best hearing aids because you can pick from whatever brand or technology level that you want as long as that prescription hearing aids is listed, registered, or approved by the FDA. However, the rules to be able to use your FEP hearing aid allowance have changed in 2024, so here are the things that you need to be aware of. First, the allowance of $2,500 was something that you could previously use every 3 years to get new hearing aids. They have switched that to every 5 years before you can get new hearing aids. So essentially, you have to wait an additional 2 years before this allowance gets reinstated. If you ask me, I think 5 years is a reasonable number. Technology doesn't change a ton every 3 years, but every 5 years, it's about time for you to upgrade. It is technically possible for you to still get hearing aids between the 3 and 5 year mark, but it requires medical necessity, and you'll have to work with your hearing care professional to actually get that approved. Second, as of January 1st, 2024, Blue Cross Blue Shield is requiring pre-authorization for you to gain access to your FEP program hearing aid benefit. This is different from before, where you did not need pre-authorization from Blue Cross Blue Shield, meaning that no matter what, even if you've had hearing aids for years and you've used your benefit from FEP before, your hearing care professional still has to get pre-authorization before you can use your benefit again. Of course, you can thank unscrupulous hearing aid dealers and companies for taking advantage of Blue Cross Blue Shield before, making it more difficult for you to gain access to your benefits. This has basically forced insurance companies like Blue Cross Blue Shield to start practicing medicine even though they don't have a license to do so, and determine whether or not your hearing loss is actually bad enough to justify hearing aids. It doesn't really seem like that bad of an idea, honestly, until you look at the criteria that is required to gain pre-authorization. pre-authorization. There are several different criteria that they actually look at, including a hearing evaluation within the past 6 months, but you also have to have a pure tone average of 26 decibels or higher to gain pre-authorization, which seems completely ridiculous. Now, this doesn't mean having a hearing loss threshold that is worse than 26 decibels. I'm talking about pure tone average, which is an average between 500, 1000, and 2000 hertz. The biggest problem with this is that most people who have hearing loss have a high frequency hearing loss. And when you take a 3-tone pure tone average, it makes it look like individuals who have really severe to profound high frequency hearing loss look like they don't have hearing loss at all. It is really not that uncommon for an individual to have a pure tone average that is lower than 26 decibels, but still have a significant high frequency hearing loss that significantly impairs their ability to communicate with people. And in this case, it would disqualify these individuals from being able to access their FEP hearing aid allowance of $2,500. In fact, here's an actual audiogram of one of my patients that was denied pre-authorization because his pure tone average was not higher than 26 decibels, despite the fact that he had really bad high-frequency hearing loss that was negatively impacting almost every area of his life, especially in background noise situations and trying to understand his soft-spoken wife. What happens in this case is that your hearing care professional can schedule a peer-to-peer conversation with one of the individuals who works at Blue Cross Blue Shield, so your hearing care professional can try to convince them that you actually need hearing aids. Now, I've done these peer-to-peer conversations before, and I can tell you that the person at Blue Cross Blue Shield really has no idea what a hearing loss is, how it's negatively impacting your life. All they're looking at is numbers, and if you don't fit within those numbers, they really have no idea how to articulate whether or not you should actually get a hearing aid or not get a hearing aid. And unfortunately, unless your hearing care professional can convince them that you actually need hearing aids, you may never get pre-authorization, which means that you will not be able to use your federal employee program hearing aid allowance of $2,500. Now, if you are lucky enough to have a pure tone average of 26 decibels or higher, or if you are able to have your hearing care professional convince Blue Cross Blue Shield that they should give you your benefit, here's how this coverage would actually work with an in-network provider. When your hearing care professional fits you with your hearing aids, whatever hearing aids were most appropriate for you from a technology level standpoint and a service level standpoint, what they're going to do is they're going to charge you for anything above $2,500, and they're also going to submit that to Blue Cross Blue Shield so Blue Cross Blue Shield can pay them the $2,500 that's still remaining on your balance. For instance, if the cost of your hearing aid treatment is, let's say, $5,000, at the time of your hearing aid fitting, you will pay $2,500, and the rest will be submitted to Blue Cross Blue Shield for them to pay your provider the other $2,500. If you go to an out-of-network provider and you're fit with those same $5,000 hearing aids, you will pay that $5,000 directly to the out-of-network provider, and then that will get submitted to Blue Cross Blue Shield, and they will send you a check for $2,500 to account for the allowance. Either way, if you go to an in-network provider with Blue Cross Blue Shield or any out-of-network provider with Blue Cross Blue Shield, you're able to access the same $2,500 allowance. Even with all the ridiculous restrictions, this is actually the nice thing about the Federal Employee Program hearing aid allowance. It allows you to go to whatever hearing care professional that you want to go to, especially if you have an excellent hearing care professional who's able to optimize the performance of your devices for you. Just be careful though, because as of July 22nd, 2024, Blue Cross Blue Shield is pulling some kind of shady stuff where they're actually trying to force in-network providers to join True Hearing to use a discount hearing aid program, which, as I talked about before, lowers the quality of care for you. Now, fortunately for you, I've made an entire video about this whole debacle with Blue Cross Blue Shield right here that I will also link in the description. At the end of the day, if you have Blue Cross Blue Shield Federal Employee Program benefits for hearing aids, consider yourself lucky because a lot of people do not get benefits that are that good. Just make sure that you have a hearing care professional who understands the pre-authorization process so you actually get access to that $2,500 for your next set of hearing aids.